Today we're getting under the hood of women's health with Rachell, a maternal health advocate, entrepreneur, and founder of A Light After 9, a nonprofit dedicated to supporting families navigating pregnancy loss, infertility, and maternal trauma. Rachell will get under the hood of miscarriage.
I didn't find out that my pregnancies were high-risk pregnancies until after I lost the babies. My first pregnancy ended in a miscarriage, and I was reassured that I'd go on to have a healthy pregnancy journey. But when I got pregnant with twins in 2020, after losing the first baby at 13 weeks and the second at 15, after following up with my OB at an ER visit, I was told that I was a high-risk patient because of all the losses that I sustained. So I kept being told that the symptoms that I had were normal and that the babies were fine, despite of having bleeding, excruciating pain, and then ultimately my water breaking. I did not know at the time, despite of being a nurse, a healthcare professional, that I was inevitably going to go into labor and deliver the baby preterm, and the baby wouldn't survive. So those symptoms, which were emergency symptoms, were told that I was told that they were normal or they were missed. I received the news that I was a high-risk patient and any other pregnancies after the first 3 losses would be high risk. I didn't know what to do with that information. I was only told that at some point I would be followed by a specialist. I didn't know what specialist. I didn't know at what point in a pregnancy. I just didn't know a lot of things that I should have known. And I couldn't advocate for myself because of the lack of education that I had regarding the issue. So I was very confused. My therapist and hypnotherapist were pivotal in my journey. When my mental health was at risk because of all of the trauma that I sustained throughout the journey, I turned to them for resources and tools to help me cope throughout this journey because I wouldn't have survived. It was so traumatic. And I was able to lean on them. And the times I felt gaslit by my providers, my other doctors, they reassured me that my symptoms were my symptoms. And that meant so much because then I was able to go back and advocate for myself. And it's probably one of the biggest reasons why I was able to then have a baby, finally, after 9 losses. But also, I had a maternal fetal specialist who put in a cerclage, which was supposed to be the quote unquote cure for my cervical insufficiency. However, it failed. And she very nonchalantly told me to go and deliver my baby at 20 weeks. She also reassured me that the baby would die at that time. And experiences like that really, unfortunately, shaped my pregnancy journey. And when I think on the journey, I have such a traumatic, experience I have to relive because of the way she showed up during that time. It was such a critical and vulnerable time. But then I replaced her with a different maternal fetal specialist for other pregnancies. And that doctor was phenomenal. She listened to me, and I was so proud of myself that I was able to make that change because as women and when we're in our pregnancy journey, we're so afraid to switch doctors. We don't want to start over so many things, but look at what happened and look at why I had to switch and look at the outcome. So it made me more confident in taking charge of my own care. And then there's Dr. Fogwell in Dallas, Texas, who, after that doctor failed, that surgery, that cerclage failed, he reassured me that this type of cerclage should have never been placed. And now I'm placing one in you and we will have this baby. He instilled hope. He had amazing bedside manners. He checked on me. I still text him today. And he is the reason that I was finally able to give birth to my son. And he was the final ray of hope that I had to not quit on my pregnancy journey when I was ready to throw in a towel. As far as coping throughout this pregnancy journey, I would be lying if I was telling you that from the first loss to finally giving birth, I effectively coped. I did not. By the end of my journey, I was diagnosed with PTSD, anxiety, depression, and rightfully so. This was a very traumatic journey. I also had trouble once I finally had a baby that was live. I had trouble bonding with him because I just knew I just knew that he would not stay with me. So for a month, I treated him as my patient and I was his nurse. So there were so many complications, a lot of loss of hope, a lot of loss of faith, a lot of loss of confidence in my medical team, a lot of uncertainty regarding whether or not I would ever hear someone calling me mom. And it messes with your psyche. It's not an easy road, and I needed help. So once I finally enrolled in counseling after my sixth loss, and it should have been earlier, but nonetheless, it was started. I really was able to hone in on those tools that I really needed to continue this journey. So she offered journaling, which I did on and off because sometimes my mind was so crowded that I couldn't even find the words to put on the paper. She offered music therapy, which I did the most. I listened to music that offered me hope and faith that I would make it to the other side. And she offered other services like EMDR. The hypnotherapist was amazing. She put seeds in my brain when I was ready to give up. And I had given up, to be honest. I had given up right before getting pregnant with my son. I had given up and I started hypnotherapy, and she put these seeds in my brain to give me hope and give me confidence to try again. And it worked. And then I leaned on my village, my husband at the time, and my friends and family. I confided in them when I could. But even that is a struggle because you don't want to keep telling someone that you lost a child. It's a roller coaster for you to go through it yourself, let alone to pull people on it when they didn't ask to be on it. So it was a lot of guilt going through that as well. But through all of that, and it truly takes a village. It truly takes a village. I was able to survive this pregnancy, and I was able to get my baby. I did not feel comfortable sharing with anybody. There were times my husband didn't even know I had miscarried. I went to work and miscarried. I felt ashamed sometimes, embarrassed, too tired to tell someone. I had fear at sometimes. And when you're telling people, oh, I had a miscarriage, I had another miscarriage, I had a stillbirth, then you have to come to the realization that something is or could be wrong with you. And that's scary to hear. It's scary to hear. That's why a lot of people don't go to the doctor just because they were scared of bad news. But it's one thing hearing it, and then it's another thing internalizing it and hearing it come out of your own mouth. And the first miscarriage that I had, only my husband knew. I think we told like some family a year later or something. The twin miscarriage with the first baby, we did tell people because we had announced that pregnancy and we were 13 weeks in. And then most of our family and friends were at the house when we lost the second twin. I didn't want to tell anybody. And going through a loss in real time when everybody is scared, confused, shocked, asking questions, yelling, crying, it made me recede. I couldn't sit with my own emotions because I was so busy trying to digest a million other people's emotions. It was really about 15 people in the house, but that's how I felt. Like I was in a crowd at a stadium going through a loss, televised. And everybody was so stuck on their own emotions that nobody could give me what I needed, which was space and time. So some pregnancies I shared the loss, others I didn't. And looking back, I did what I had to do because I was in survival mode. So whatever that looked like at the time, whether it was telling early, telling late, or not telling at all, I did what I had to do so that I could make it through this journey. The accessibility to care that you need and the accessibility to education. When I got pregnant the first time and then got pregnant the second time, I had no idea what a cervical cerclage was. I had no idea. I didn't know what a maternal fetal medicine specialist was. I didn't know a reproductive endocrinologist was a thing. I only knew of regular endocrinologists. I didn't know what a reproductive geneticist, I didn't know that was a thing. I didn't know about all of these reproductive specialists that I would need along my pregnancy journey. I didn't know about the cerclage and the types of cerclages and the options that I should have been offered up front until it was too late. I didn't know what I didn't know. And it cost me 9 pregnancy losses. And if I can go back in time, and if I can encourage anybody else, I would ask the doctor and grill them on what are all my options. What if? I would ask that question. What other testing can we do? What are the other options? What are the risks of those options? You know, when you're coming to this, unless you're pregnant, you're OBGYN or a maternal fetal specialist, you just don't know all of these things, but you're depending upon your healthcare provider to tell you when and if you need to know. And that doesn't always happen. And unfortunately, it ends with situations like mine. Well, after my pregnancy journey, I had a lot of health complications. One being too much fluid in my brain, and my neurologist and neuroophthalmologist attributed to being pregnant so much and so long. And because of that, I could possibly die if I get pregnant again. So I had to sit with the reality that I could never naturally give birth again unless I wanted to potentially risk my life. And that it's still a hard pill to swallow. It's still very hard to know that if I wanted to, I could never carry a baby again safely. And there can't be any accidents. So this week I got my tubes tied, and it was, out of all the surgeries that I had in the last 4 or 5 years, that was easily the hardest and the most life-changing. So when you go through things like this and you go through such a traumatic pregnancy journey, when you finally get the baby, and maybe I'm foolish for thinking this, I thought that that was the end of the trauma and that I would be fine after that. But to know that there's still more and that the aftermath of it all is also traumatic is just a lot to deal with. So it shaped me in a way of thinking, motherhood really, really does not look like anything I thought it was when I started this journey from beginning to end. And I want to encourage other women to not put so much pressure on themselves when it comes to motherhood, because we can't predict this. There's no way in life that I would predict it right here, right now, that I would have had 9 losses, finally had my son, and then I couldn't have any more babies, even after the surgery. So if you can, remove that pressure so that if that journey is difficult for you, that you're able to take it as it comes and not add in that extra pressure of, what's supposed to be. So from 2018 to December 30th, 2022, I experienced 9 losses and 1 live birth. And it took a major toll on my mental health, my physical and spiritual health, my emotional health. It was a roller coaster of a journey that I couldn't have anticipated if I tried. And I'm still trying my best to cope with it on a daily basis. Not only that, I'm trying to cope with the aftermath of having to get my tubes tied because I would die if I got pregnant again. So there are so many things that I wish I would have done. And now that I'm on the other side, I can tell you what to do so you don't have to go through this. And so you don't experience this. Now, granted, I'm not promising you at all that you're not going to have any mental health tolls or, physical issues throughout your pregnancy. That happens. but I would never want you to have 9 losses. And I would never want you to sustain the type of trauma that I did in the amount of time. So if I can go back in time, if I can start in 2018, I will start with counseling and mental health resources sooner, before conception, so I could prepare and brace myself for this journey. Because there is nothing that you can do to anticipate losses of this magnitude, but you can have the tools and be ready to cope with such losses, at least better than I did. In 2024, we shouldn't have 9 pregnancy losses before having a baby. So the education is out there, and we can reach out to our providers, or we can reach out to our other educational organizations that we have. And there's so many of them, such as A Light After 9. So if we're doing that work and getting that education, we're able to better advocate for ourselves. So you're not having 9 pregnancy losses like I did. Because you can go into that doctor's office with confidence to know these are my options and that I'm going to choose this one because it's the best one for me. We're able to have those tough conversations. And then I would give myself some rest. That was a long journey, but not once did I mentally or physically rest long enough to at least stop and look around and figure out what was going on with me. But you're able to. You're able to give yourself that space, whether you can't talk to the family right now, whether you can't show up for work and you need that PTO, whether you can't make it to that event, especially that baby shower, because it's too overwhelming. Prioritize yourself and give yourself that space you need to heal while you're on that journey. You don't have to rush it. But I will say that despite of this 4-year pregnancy journey full of loss and trauma, I am on the other side now. And I am able to help you get to the other side too. And I am able to give you all of these words of encouragement because you can make it and you will make it. And whether pregnancy and motherhood looks exactly like you thought it was from the beginning or not, you can be on the other side.